subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Aditya Agrawal. Dr. Aditya Agrawal has been here with us several times over. 1, 2, 3, 4, 5, 6, 7. This is the seventh time he's been there. So welcome, a very warm welcome to you. Aditya, how have you been?
Very well. Thank you so much for inviting me once again.
I'm going to do that. I'm going to take a short break and introduce you. So Dr. Agrawal is a leading consultant pulmonologist attached to several large hospitals in Mumbai. He is extensively trained in respiratory diseases both in India and in the US. His special interests are in difficult to treat cough, asthma, bronchitis, and lung fibrosis, and runs a specialized clinic for patients with chronic cough. He's a dedicated researcher and a peer influencer in the management of respiratory diseases. Earlier this year, he was awarded by the governor of Maharashtra for treating over 10,000 COVID patients through these last 3 difficult years. Welcome to Health Live once again. Doctor, how have you been? And, I still remember 2 years back when we've had you so many times over, you were there and you had 2 phones in front of you. We could see it. And even as I was introducing you, you would be attending to calls and perhaps advising some patients, etc. I know those were crazy days, but I hope the pace is much better now.
Oh, thank you for inviting me over. Yes, definitely. We don't see as many COVID patients, and even if we are seeing these COVID patients, they really have mild disease. Though, with word of caution, we are still seeing one odd patient falling through the cracks who may develop severe COVID, landing up in the hospital ICU. But again, they are very few and far between. So it's extremely important that anybody who hasn't been vaccinated until now gets vaccinated and also gets their booster dose for the COVID vaccine. Second thing is it's important to make sure that your chronic illnesses such as high blood pressure, diabetes, ischemic heart disease, which is basically heart disease, are well controlled, well taken care of, and especially respiratory illnesses such as asthma, bronchitis, COPD, your allergies, etc. Because every time you have one of these chronic diseases, your ability to withstand any form of stress in the form of infection goes down. So it's extremely important that you take care of your general health to ensure that you don't fall prey or you do not fall severely ill with any other infectious disease. I won't limit that to only COVID, but it could be any respiratory or any infectious disease which could affect any part of it.
Absolutely, doctor. I think it's important to take care of your health, and we will, of course, talk further about it. Doctor, this is the 3rd time perhaps that we've asked you to speak about asthma, and as I say, this is we are entering the winter months, and air quality levels are going down everywhere. It's important to speak with you and get an idea of how things are and what people should do, and which is why we have our viewers and readers who gather here to listen to you and what they can do. Not that things change every year, but the point is that we've global warming and the weather conditions are changing so rapidly. A city like Mumbai, which would have a near summer in September, October, as those months have just vanished, and it is more of the monsoon, and then the chilly weather sets in. So we are looking at changes in the weather, and whether these are man-made or act of God, one can't ever speak. But so over to you, doctor, for your opening remarks on asthma, on winter care, winter diseases, and those of you who have gathered here, please feel free to post your questions on the Q&A tab, and we would address them to Dr. Agrawal as soon as he finishes his opening remarks. Over to you, doctor.
Thank you so much. Today I'm going to speak about asthma like I often do. And what I would actually encourage is participants asking me questions. I would love them to interact with me rather than me just, speaking about stuff they may read off the internet also. Uh, what asthma really entails is that you have sudden increased resistance, or rather, you have sudden bronchospasm. That means your tubes in the lung suddenly shrink and shrink because they are exposed to certain stimuli in the environment. It could be dust, it could be smoke, it could be changing air temperature. So basically, when you have an asthmatic or you have any patient who has chronic lung condition, you will realize that changing weather is something which triggers their respiratory symptoms. So what's happening here is that because of this prolonged um, weather change that we are seeing, patients are coming back to us with bronchospasm, wherein the airways, the tubes are completely shrunk, because of which the amount of air which they can blow out is very low. Because the airways are constricted, because the tubes are shrunk, what's happening is air is stuck inside the chest, and they often come to us just with complaints of chest pain, or they may complain of wheezing, which is a whistling sound from the chest, or they will come back and say that they aren't able to sleep, or they will come back and say that they have incessant cough, which doesn't go despite any forms of therapy at home or cough syrup which they have been prescribed either by their family doctor or by the local friendly chemist. It's important to understand that any trigger is the first trigger that happens is the triggers at home. So indoor air, sorry.
It's okay. You can go ahead.
I know I got that message from somebody saying that the voice quality was not that great. Is it better now?
Yeah, it's better now.
Sorry. Yeah. So basically, when we speak about asthma or we speak about bronchitis with the shrinking tubes, it's extremely, extremely important that we take care of these tubes. And as winter sets in, we will realize that more and more patients with chronic lung diseases, especially after COVID, are coming back into the clinics for acute care. What's important is that once we realize that we have chronic lung conditions such as asthma or bronchitis, it's important to see your doctor when you are healthy, in your healthy state. It's just as a precautionary thing, like how we do with our cars before monsoon. We have a mandatory car checkup or a service before the monsoon hits us. Similarly, why it's important to understand the level of control of your asthma or your bronchitis is that uh, what happens is because of your chronically uncontrolled asthma, you'll end up with an exacerbation which may set you off into an ICU or in a hospital. As a doctor treating asthma day in, day out, we look at certain health metrics, and the most important or the most important one is the number of times a patient has had an asthma attack or a bronchitis attack in the preceding 12 months. Somebody who's had an uncontrolled asthma or asthma wherein the patient is symptomatic for more than 4 weeks, then we understand that such a patient will have a very high risk for future asthma exacerbations or future asthma attacks. It's important that we speak to such patients, explain to them that they have poorly controlled asthma, and get them to control their asthma. Now, when we speak about winters, the first thing that we speak about is the air temperature. Yes, there is something which you and I cannot control, that is the air temperature. So what we should do is we should avoid extremes of temperature. So do not stay in a very warm room and then suddenly go out into the open where it is colder. Keep your air conditioning at a temperature which is close to the environmental temperature if possible. Make sure you're using air purifiers inside the home, because extremely important, because what happens with winter comes the increased uh, increased particulate matter in the air. Very often we have people, especially in North India, using fireplace or using heaters, which cause dryness of air, which increase the amount of carbon dioxide in the air with, when you're using wood as a wood to light up or to warm your home, or even though heaters increase the amount of carbon monoxide that you have, if you are using one of these heaters, make sure that you have the carbon monoxide alarm set in place so that in case somebody does have a very high amount of carbon monoxide, he is pre-warned and he does not end up in an emergency requiring ICU admission. The other important thing is do not light too many candles, scented candles, especially around Diwali. We tend to use a lot of incense sticks, or we tend to use a lot of diyas, we tend to use a lot of candles, and so on and so forth. And all these cause increased particulate matter in the air inside our homes, and this tends to linger on in the air that we breathe and can exacerbate or cause an asthma attack. Air purifiers really help here. If you are living in the north of the country, it's extremely important because you understand that there's so much stubble burning, etc. Those are all political issues which we should not be dwelling upon. But there is significantly poor quality of air. Just last weekend, I was in Delhi, and the minute I landed into the Delhi airport and I was getting off the plane, I went into a sudden asthma attack because of the poor air quality. A friend of mine traveling with me also went into an asthma attack immediately, and we both being chest specialists could identify that it was the poor quality of air which triggered our asthma immediately. So again, it's important that if you are an asthmatic and if you need your inhalers, make sure you always carry one with you. If you're asthmatic, make sure that your asthma is well controlled. Make sure that you are well controlled, not as per your symptoms, which you perceive, but by the health metrics or the criteria as prescribed by a chest physician or a chest specialist. When we speak about asthma, again, we need to ensure that there are triggers for your bronchitis or lung diseases, and the most common ones being infection. I'll speak for myself. My entire family had taken the flu vaccine earlier this year in the month of May when the new vaccine strain was just introduced. I, however, missed it. I was busy traveling and working, and I just forgot to take mine. And come June, and the monsoon hits us, and with monsoon came a surge in the number of H1N1 or the influenza viral infections. I unfortunately landed up getting one. And after 8 long years, I've had an asthma attack, which prompted me to use my inhalers for 3 months on a trot, which is quite surprising considering that I knew how to take care of myself and my asthma. But if I had just taken that one simple vaccine on my arm, which would have taken less than 30 seconds, I would have prevented 3 months of torture, several nights of incessant cough wherein I could not sleep, lots of wheezing, lots of breathlessness, lots of work hours lost, lots of lack of concentration, lots of time spent with my son, which is again poor quality of life. Another thing that's important is it's not just the flu vaccine, it's also important to prevent or to protect ourselves from infections such as streptococcal pneumonia infection, which is basically prevented by 2 simple vaccines, which are called the Prevnar 13 and the Pneumovax 23. You could ask your family doctor to have it given to you, or you could always reach out to Mrs. Lesha Pawar, who is our special in-house nursing in charge, who can give this vaccine to you at our clinic. Out here, what's important is that by taking these 2 simple vaccines successively 2 months apart, you are getting a lifetime immunity against a bacteria called Streptococcus pneumoniae, which is the most common cause of respiratory infections amongst all bacteria. By preventing this infection, you can actually prevent several bouts of sore throat, pneumonias, etc., starting from a young age. And now it's become a mandatory thing for most pediatricians to give these vaccines to children. However, what we miss is that even the elderly or even the adults need the same vaccination, because growing up, we were not given these vaccines, or we did not have access to these vaccines. moving on from the infection part, it's extremely important to understand what else can we do to prevent winter exacerbations or winter worsening of our respiratory symptoms. So it's important to make sure that we maintain a clean environment at home, at workplace. It's important that we just not care for ourselves, but also for our neighbors. And very often you've seen people lighting bonfires on Diwali or later. We've seen people lighting up wood inside the home. So rather, not in Bombay though, I'm talking about North India. So you would rather do that in an open space where there is ventilation. When you're cooking at home, make sure that you are cooking in a well-ventilated space. In the bedrooms, we tend to use a lot of blankets. We tend to use a lot of linen there. Those patients who are prone to asthma or allergies, it is imperative that you reduce the total amount of bed mite in your linen. And for that, make sure you're changing your linen frequently. If you aren't able to change your linen frequently, ensure that you are using a hot iron and ironing your linen before you go to bed. Ensure that you do not use woolen blankets, and if you need to use woolen blankets, make sure they have some kind of a cover. Make sure your mattresses are deep cleaned. Make sure your mattresses do not have bed mite. Get them covered with plastic sheets. They are basically called mattress protectors. Make sure you're using fiber-based pillows and do not use down feather pillows. You do not use down feather duvet, because all these will exacerbate, or the protein material in the down feather will exacerbate or worsen your asthma or bronchitis for that matter. If you do tend to use a lot of woolen blankets, make sure that they are deep cleaned before you are exposed to them. Do not use lots of air diffusers in the home. Do not use air fresheners in the home. Try cleaning surfaces as much as possible with a damp cloth instead of having them dry dusted. So those are the simple things that you can do to protect yourself from the winter allergies. Other important thing is, when you have asthma or when you have chronic bronchitis, you need to hydrate yourself. Every time you have a dry mucosa or the dry skin on the inside of your nose, inside of your chest, you're going to end up with a lot of your asthma attacks. So good hydration is extremely important. Another important thing is that if you have asthma, visiting your doctor will actually prompt your doctor to give you something what we call the asthma action plan, which is a action plan or a pre-hospital or a pre-doctor visit self-care program wherein we give set of instructions to a patient to take certain medicines when they notice an increase in the number of symptoms that they have. So any worsening of cough, any worsening of breathlessness, increased wheezing, changing color of your sputum, changing color of your bulgum, as we commonly call, should prompt you, or any fever should prompt you to start by doubling the dose of your inhaler, by taking a certain set of medicines such as oral steroids if the need be, before you can actually see your doctor. By doing these simple things, you would actually prevent a lot of morbidity, a lot of illness. This sufficiently buys you enough time. This may not be relevant as much as in Bombay, as when we compare to the Western countries where access to doctors is not that easy. I mean, today in Bombay, you need a doctor, you'll find dime a dozen by just a phone call. But what this will do is it will prevent you from having severe asthma attacks, which would actually entail you to be hospitalized. Yeah, so those are the things that we do for our winter care. I would actually encourage participants to ask me questions if possible.
Right. Thank you very much, doctor. But tell me all the things that you said, all your recommendations about woolen blankets and dust mite and mattresses and all of that. Has life got more complicated now for all of us? Were these prescriptions that you made, were these there even earlier, or is it all the new era problems that are there and that they need to be solved by the ways that you recommended?
You know what? If you have noticed, you have actually seen medicine evolving tremendously between March 2020 and March 2022. You have never seen an evolution in respiratory medicine like you have seen in these 2 years. What's important to understand is these are problems which have forever existed. Most elderly patients who come to us and with a diagnosis of asthma are somehow people who have resigned to their fate, wherein they will say that they have symptoms and they will continue to have them. Or most patients are reluctant to accept the diagnosis of asthma. Sorry. The reason for not being able to accept the diagnosis of asthma in our country and why still doctors call it bronchitis to make sure that the patient comes back to them or the patients are not frightened is because patients assume that all breathlessness, be it of any cause, is asthma. Whereas asthma is a very specific condition, which is an allergic condition in most states, where there's a definite trigger which is causing your airways, your tubes in the lung to react to something, react to an action which is basically a irritant which goes inside your lung. If that irritant is not there, then you will not have an asthma attack. And to make some things very simple, if you have asthma, you can live a normal life like any other person. Giving a simple example, do you know that David Beckham, a professional footballer who runs those 9 to 10 miles in the 90 minutes, has asthma? You and I would have gotten tired in that time, but he, despite having asthma, is able to do that. 20% of Olympic athletes have asthma. In fact, there is a special type of asthma which is called exercise-induced bronchial asthma, which is very specific, wherein a patient will not come, or rather a person will not complain of any symptoms, but 10 minutes to 15 minutes into his run or her run, they will say that they are having chest tightness, or they may have bouts of coughing, or they may have complaints of breathlessness. That is exercise-induced bronchial asthma. Now, when we speak about the blankets, etc., what's happening is because of the evolution, our understanding of the disease has gotten so much better. And we realize that it is not just medication which is important while treating asthma, but the whole thorough knowledge of why the disease happens can prevent a lot of unnecessary asthma attacks. Do you know we can actually prevent most asthma attacks by just ensuring that a patient has well-controlled asthma? So, if you don't prevent or don't control your asthma, the risk of you developing severe asthma only worsens.
All right. Thank you, Doctor. Doctor, we have a question that has come in from Nisar Ukaboy, who asks, can you please repeat the names of the vaccines for the anti-infection and whether to be taken annually prior to the monsoons?
So the vaccines which you need to take are the flu shot, the flu vaccine, which your family doctor can very easily prescribe to you. The other vaccine that you need to take are the vaccines against pneumococcus, Streptococcus pneumoniae, and they are called pneumococcal vaccines, and there are 2 of them. So if you are below the age of 65, you take one of the vaccines and then you take the second vaccine after 2 months, and then that gives you a lifelong immunity against this bacteria. If you are above the age of 65, all you need to do is take just one of the vaccines, and that's all.
So which of the vaccines has to be taken if you are 65 and above?
It's called the Prevnar 13, and you take the flu shot every year. The best time to take the flu shot is pre-monsoon, because that's when the new strain is released every year.
If a person hasn't taken the flu shot so far, like myself, for instance, I haven't taken the flu shot. Is this a fair time to take it?
Yes. So you have the second strain of the flu shot or the flu vaccine, which is usually released in the month of September. So you would have the latest strain available to you right now. Uh, yeah.
Yeah, we will write it down, and this is for Kashmira Shah. We will write down the name of the vaccine. Actually, you will, you can hear this, the recording of this all over again on Monday when it is there on the Seniors Today website. So don't worry about that. So, Doctor, you said about you can take it now, etc. But tell me, one of the things that we've learned about vaccines and we've with COVID, because earlier, one would go for the vaccine and one would think that that's it. But as we have seen with COVID, is that you may take a vaccine, but there's a new strain of the disease that can come up. So are these, and you yourself said that there are there are two releases of these vaccines for flu. One is pre-monsoon and the other is in September.
Pre-winter.
So, sorry?
Pre-winter.
Pre-winter. Now, could it also happen that in the month of March or April, which is much before the monsoon and much before winter, you could well have a new strain of flu which comes in and which could afflict people who have taken the vaccine?
Yes. And you know how every year the strain usually changes. And the companies all across the world actually gather data and understand which is the most prevalent strains available or rather in the society, and then vaccinate or rather make vaccines with those strains of the influenza. So that is why you have the changing vaccines every year. So if I'm not mistaken, between the between March 2020 and 21, or rather 2019 and 2020, there was no change in the strain because the same dominant strain was prevalent amongst in the 2 years. So there, the patients were advised not to take the flu shot because the previous year's vaccine would be highly effective.
Right. Thank you. We have a question from Mr. Suresh Khate who says, I'm 70 years old, have problems of regular cold, sneezing, nose flowing, irritation in the throat for the last 10 years. Doctor has advised me only steam inhalation, warm water drinking. He has requested you for your advice on what he should be doing.
That's a very specific question, and I don't think this is the right fora to answer that. But yes, definitely you would require a thorough evaluation with regards to your allergies. Apart from that, it's very important to understand that have you been somebody who's very prone to allergies since you were a little child? Because most patients who have allergies as adults have had allergies as children. A simple example, I've had asthma since I was a child. I have asthma now, which is better controlled now. I have had a runny nose, stuffy nose, allergic rhinitis. I've had tonsils. I've had adenoids. I've had eczema. I mean, the works actually at different points of time in my life because I am somebody who's very prone to allergies. So each person has different forms of allergies at different points of time. It's just a trigger which is important. There are several factors which need to be taken into consideration when we are determining who is having allergies, when they are having allergies, and what they are. You may have allergies starting from your skin. You may have allergies of your eyes, where you have frequent allergic conjunctivitis, which is basically red, itchy eyes, dry eyes, etc. You may have sneezes. You may have a stuffy nose, runny nose. You may have allergies in your throat. You may have tonsils. Children may have adenoids, which are because of allergies. You may have asthma. You may have bronchitis, as we commonly call it. You may have food allergies, wherein food is causing an upset tummy. You may have gluten allergy, peanut allergy. You may have milk allergy, so on and so forth. So basically, a lot of times we see women coming with cosmetic-induced allergies. We have patients coming in with junk jewelry associated skin allergies. You have so many different forms of allergies. So it's important that you identify them and control them. Now, very specifically for your condition, you need to go and see how severe your allergies are, how severely your body parts are affected, and then get the right treatment.
Right, absolutely. And my recommendation to you, Mr. Suresh Khate, is that uh, while sessions like these give you advice, many of them are specific advice, but there's nothing which can replace a visit to the doctor, because the doctor will examine you clinically and be able to give you just the right advice for you. But of course, we are around for you to take a second opinion and get more get more recommendations on what you should be doing. We have a question from Mr. Debendu Ganguly, who says, I'm 62-year-old male, have had eczema since I was 25. Is it true that the two conditions, I guess, are asthma and eczema, have the same roots?
I mean, if you remember in school, we used to speak about something called the Venn diagram. Just
Right.
consider atopy or allergy as the universal truth, universal box. And you may have several forms of allergies which are just enlisted. So, yes, they do, they are all forms of allergies affecting different organs, and they have similar um, immunology, similar causes in the body, wherein you have an irritant which goes and affects your body reacts abnormally and excessively, trying to prevent that thing from causing more harm to your body. And in the process of trying to protect itself, it ends up harming itself. So that's asthma, that's eczema, that's any form of allergy for you. If I were to give you a simple, example, or rather describe it in a way, would you go and kill an ant with a simple tap, or would you use a hammer? When you use a tap, you'll kill the ant. But if you use a hammer, you'll also hurt yourself. Similarly, your allergies are basically your body hitting so hard against something that it starts affecting the body itself.
Right. Thank you. We have a question from Mr. Narendra Shah, who's 70, and he says, I'm suffering from cough, and in cough, food particles goes after the breakfast, lunch, and dinner. Please advise what to do.
So when we speak about cough, you may have cough because of several reasons. I won't have a specific answer for your question, but I can just explain to you what cough is basically. Anything which goes into your lung or your windpipe will cause you to have a cough, or anything inside your windpipe will tend to cause your body to produce cough so that it is thrown out. Now, when you speak about the specific cough which you have, where you're coughing up food particles, at your age, I would think of two very important things. One, acid reflux, which is a common cause, one of the most common causes of cough in elderly. The second important thing that I would think about is what we call aspiration, wherein because of some neurological problem or because of your body unable to protect itself or close the vocal cords closing when you are eating something, wherein because of that food is going into your windpipe and causing you to cough up these food particles. Otherwise, your food pipe would never have any, or rather your windpipe would never have any food particles.
Doctor, we have a question from somebody in Delhi, uh, where you have recommended the use of air purifiers to us in the past as well as now and now. But the air purifier is there only in some of the rooms and it's not there in all the rooms. Would you recommend that we have the air purifier in every area of the flat, for instance, in the kitchen and the washrooms, or is it only required at the place where one is spending a lot of time, especially sleeping, or in the living room?
Uh, you have air purifiers of different sizes, and when we consult large organizations, or we consult companies for their office spaces or hotels or malls or large homes, we tend to get large industrial size air purifiers. But for homes, usually you have air purifiers which can cover a space of about 1,000 cubic feet to 3,000 cubic feet. I consult a lot of air purifier companies, and I won't have any specific companies air purifier in mind, but it is important that you tend to reduce the amount of indoor air pollution by different means, by keeping your windows shut, by ensuring that the rooms are clean, ensuring that you do not use aerosols inside the home, rather than you buying a air purifier for every corner of your house.
Right, doctor. But tell me something. You mentioned, and I've asked you this question in the past. There are air purifiers of all types. While I would not push you into giving a name of an air purifier, but is there anything specific that one must look for while selecting an air purifier? For instance, there's a well-known international company which has not just one but multiple models of air purifiers, starting from around 8,000 rupees till around 20,000 rupees. Now, which is the right air purifier to have from a medical point of view? And then you don't have to give names, but just a recommendation of what the specifications perhaps should be.
So when we speak about air purifiers, it's important to understand your specifics. What is your need? What area are you trying to cover? What is the size of the rooms that you are going to keep the air purifiers in? And then decide upon the kind of air purifier that you're purchasing. Second, the most important thing that any air purifier should have is a display unit where it tells you the air quality index. So I have several brands of air purifiers in every room of my office, of my home, and each of them I have ensured that they have an air quality monitor. Second thing is all of them are connected to my phone over wireless or Wi-Fi. So I can actually switch on my air purifiers before I get home. I get access to the air quality in my home or in my office before I'm in my space. So basically that tells me that, I am going to walk into some place which is very polluted at that particular point of time. So I would probably crank it up a little more, increase the fan speed, etc. Use it for longer. I mean, keep it on for a longer period of time before I head there. So, again, these are the two most important things that you should be looking at. The size of the area which air purifier can service. Second is air quality monitor.
And is there a mask that you would recommend? Because it's not possible for someone to have the air purifier all the time. Is there, for instance, if you may be going in a rickshaw or in public transport, etc., would you recommend any specific type of mask?
Any two-ply mask should be sufficient. But if you are indeed living in a very polluted part of the country, such as New Delhi for now, using an N95 mask may help. But again, there are no specific guidelines which, will tell you to use one particular mask over the other.
Right. Thank you, doctor. There's a question from Mr. Malcolm Montero. You of course spoken about it. He says the flu vaccine, is it annually taken? The pneumonia vaccine, what about that? Is it also annual? And is the COVID vaccine also now an annual vaccine? He is 69.
There's no sufficient data to tell you that anything beyond the first booster is going to be beneficial in preventing future attacks or future COVID infections. It's still something, medical science is still in evolution, and probably in the coming years, we will understand if we need any more boosters, barring what we have already received from the government of India.
Right. We have a question from Jayanti S, who says, I'm 61. Winter season induces asthma for me. Mild to moderate asthma is diagnosed. Protection with sweater, cotton for years, head and neck covered with cap and muffler and a mask. Will all of this suffice for prevention? She is from Bangalore and she says she drinks warm water and avoids cold things.
I would tend to agree with Mrs. Jayanti, except for that drinking warm water bit. I am a complete advocate for not having hot or very warm water. But yes, definitely any trigger. So changing air temperature is a trigger for your asthma. which is the reason why you have asthma attacks in winter. So personal protective clothing, such as what you're using, the sweater, the mufflers, etc., are going to help you.
Great, thank you. We have one last question: Is aerosol and room freshener harmful for asthmatics, even if they're tolerant to their fragrance?
So you don't know what, so basically any particle which enters your airways may potentially trigger your asthma or your bronchitis. So you need to be able to identify your triggers, and until you have that understanding that any of these aerosol particles, they are not limited to you only. Anybody else in the home may also be exposed to those aerosols from room fresheners and trigger their bronchitis or asthma. You may not react to a particular fragrance, but you may react to another. So changing, fragrances can also worsen your asthma. So ideally, you need to reduce the total amount of aerosol in the room. And for that, you need to make sure that you stop using these room fresheners. Clean the room rather.
Thank you, Doctor. Thank you, Doctor, for your time this evening. It is an important topic that we keep discussing, because asthma and respiratory ailments is something which is very important, and it's a function of weather changes. So, which is why we thought of doing it right now in this month of November, and ahead of the biting cold that sets in across the country. Doctor, we have one last request. And unfortunately, I'm not able to really address it, but could you possibly put the names of the vaccines in the chat box so that everybody can get the spellings?
So I'm just going to give a very broad, it's influenza vaccine. There are multiple companies which make the influenza vaccine. You can choose a brand of your liking.
The other two vaccines that you mentioned, which is for people up below 65 and for people above 65. I think that's the one which.
Yeah, I've had these two names put up there.
So this is Prevenar 13, Prevenar 13, and Pneumovax 23, that is Pneumovax 23. Thank you very much, Dr. Agrawal, for this session. This is the 7th time you're here, and I must tell you that it's really very good to have you all the time. I still remember the days when you were there earlier and you were so busy, and you had a couple of phones in front of you, as I mentioned earlier, and there were calls coming. So it's good to see that you're not as busy as you were at that time. It of course speaks a lot for the state of the country and the health of the country, that doctors like yourself are less busy and do not have to really attend to patients across. I'm going to, before signing off, say that we at Seniors Today are really delighted to bring you seniors, various activities around Seniors Today. And I'm going to request the producer to quickly put in a calendar of various events that we have. We started off with health webinar in June of 2020, and now we have a host of sessions. So we have dance session. Yes, you can dance as well. We have little known stories by Mohan Krishnan, which is alternate for evenings. We have Housey by Feroz. Then on Tuesdays, we have an open house by Lakshmi Narayan, who I miss in these sessions. He was very regular earlier. On Wednesday mornings, there's Zumba, and there's Seniors Have Talent, which the 9th season 9 of Seniors Have Talent is starting on November 9th. Yeah, and it has thrown up a host of singers, and I can tell you that it is personally exhilarating to see so many seniors having a great time and expressing themselves through their talent. On Thursdays, we've gone a step further, where we have Antakshri, there's karaoke singing, which if you haven't joined already, you must do it. Mr. G.D. Sharma, who was the Seniors Have Talent winner, and he says in Chennai, he teaches you singing aided by karaoke. On Friday mornings, there's Anita Rakshit and her yoga sessions, and she sometimes does meditation. Alternate evenings is poetry and prose by Sajni Vedya, and on Saturday mornings there are acting classes by Mohan Krishnan again. And this, of course, is there on every Saturday evening at 5 p.m. the health webinar. So that's where our program is. In case you want to attend the health webinar every Friday, every Saturday 5 o'clock, you must just pre-register, and we will ensure that you are registered for every Saturday evening. You don't have to really wait for us to announce our sessions. Next time we are looking at somebody who is a doctor who's going to talk about kidneys and stones, etc. So we keep looking at issues that are there. In case you have any suggestions for what we should carry, please feel free to contact me at editor@seniorstoday.in. I'll repeat, editor@seniorstoday.in. I'm going to put it down on the chat as well. You can write to me. I look at each and every mail myself. Sorry about putting it in caps, but I look at each and every mail myself, and we'll definitely look at what we can do. Thank you very much, Dr. Agrawal, for once again for being here and for painstakingly advising our readers and viewers here for on asthma, on winter care, and we hope to see you once again on a different issue. And of course, otherwise, we will obviously see you soon enough for on respiratory ailments, etc. And I was speaking to Dr. Agrawal before this session, and he was underscoring the need for adult vaccination. He was talking about, he mentioned about the fact that the rest of his family took the vaccine for flu, but he did not. And so those of you who are there, as you know, we've had a session on adult vaccination, on immunization in the past. So please do equip yourself with the right information. Dr. Agrawal has spoken about the 2 vaccines for people under 65 or over 65, another one, and the influenza vaccine. So please educate yourself, inform yourself of the need for adult vaccinations. And of course, we will have Dr. Agrawal once again on our show. Thank you very much, and see you next week.
Subscribe now and press the bell icon. Never miss an update.